Now, hello, I'm Glenn Poole from the Australian Men's Health Forum, and today I'm going to give you a short talk about men's heart health and 10 key facts I think everyone should know about men's heart health. I'm going to cover 4 areas: key facts, your health, taking action, and the 4th one I can't see because of the Zoom box, and how you can help others. So, some key facts about men's heart health. Did you know that heart disease is actually the leading killer of Aussie men, killing more than 10,000 men a year? That means that 1 man every hour is dying of heart disease. And it actually kills more men than prostate cancer, suicide, bowel cancer, and road accidents combined. And particularly in younger men, the majority of people dying of heart disease are men, with 4 in 5 people who die of heart disease under 65 being blokes. It's also a social issue, with poor men being more likely to have heart attacks than rich men, and poor men being 4 times more likely to have a heart attack than a wealthy woman. But what about you and your heart health? I hear you cry. Well, there are some common risk factors that can increase your likelihood of having heart disease, and here they are. You'll see some of those are things we can't change: our sex, our age, our family history, but some are things we do have some influence over, whether smoking or losing weight or getting more active or improving our diet. And I'm sure every single one of us could spot one risk factor that we could actually improve. The 3 key ones that all men can take an action on is being more physically active, taking care of our weight, and looking after our mental health. Did you know, for example, that men of working age who can do 40 push-ups are 10 times less likely to get heart disease? And also, maintaining a healthy weight is one easy way to keep our heart healthy, as is taking action to keep our mental health on an even keel. But what action can you take now, this week, this next month, to actually help beat heart disease from your own perspective? Well, there's 4 things every one of us should know, 4 key numbers. We should know our body mass index, we should know our blood pressure, we should know our cholesterol levels, and our blood sugar levels. Well, how are you going to know those? Well, if you're 45 and over, go to your GP, because heart health checks for men over 45 are now free on Medicare. And they can tell you those 4 numbers, and you can find out which one of them you might need to take action to improve and reduce your own risk of heart disease. But what about our mates? How can we make sure that our mates are keeping their hearts healthy and not at risk of a death by heart disease? Well, there's some action we can also take to save a mate. Firstly, we actually need to know what the signs of heart attack are, because, you know, a mate could drop dead, or someone in the street could drop dead, and if you didn't know what was happening, you wouldn't be able to help. So firstly, key signs of heart attack in men are pains in the chest, shortness of breath, pains around the shoulder, neck and jaw, and a cold sweat. And you want to know, first off, what can happen what to do if that could happen to you. Well, if it happens to you, rest, sit down, stop, reach out, make sure that someone knows that you're going through something, and then call 000, because the vast majority of people who have heart attacks die. But if you get help, you can be saved. Same if you actually encounter a mate having a heart attack, do the same thing. Make sure they rest. Make sure that someone knows about it, call 000. And you don't have to wait for emergency services to come, because actually knowing CPR, you could actually save a bloke's life. I just met a bloke yesterday who had a heart attack while cycling, and the fact he was only 52, and the fact that a couple of people came cycling past who knew CPR meant that he's still alive today to tell the tale. So quick steps for CPR are: you need to call 000 so that you get emergency service on the way. Do those heart compressions to the rhythm of Staying Alive, staying alive, staying alive. And if there's one near, use one of those machines. Learn how to use those and find out where the nearest one is. So those are the 10 facts we've covered that I'm going to flick through. But that's all you need to know about men's heart health